Welcome back guys. Now in this video, let's discuss about the cell death. Already we have discussed about the reversible cell injury as well as irreversible cell injury. Okay, these two things already we have completed. Now in this video, let's continue with the cell death. Now, how many types of cell death I have explained you? There are different types of cell death like fibrinoid, necrosis, apoptosis, pyroptosis, necroptosis. I have explained you about the 4 types. Now we have to see them in detail. Out of all the different types of cell death, the 2 major types of cell death are necrosis and apoptosis. Before going to discuss about the different types of necrosis, first let's see what is the difference between necrosis and apoptosis. What's the difference between them? So, what are the 2 major types of cell death? One is necrosis and apoptosis. Now, first of all, necrosis is always pathological. Okay, always necrosis type of cell death is always pathological, which means the cell doesn't want to die. Because of some pathology, the cells are being killed. Okay, so it's like a murder of the cells. Okay, we consider necrosis as a murder. Okay, the cell doesn't want to die at all. Someone from outside, there is this pathological process happening which is leading to the death of the cells. So, always pathology, not physiology, always pathological. But on the other hand, apoptosis may be physiological. Okay, may be physiological or pathological. So, most of the times it is physiological and even sometimes it is pathological. How to understand it, sir? See, there are certain times in our body where cells are supposed to die. Okay, certain cells in our body are supposed to die, they have to die. So, the cells will make a program, they will have a blueprint how to die. Okay, so there is this process of cell death which is happening by the usage of energy. There is absolute blueprint. So, such type of cell death is called as apoptosis. In necrosis, there is no such thing. The cells will simply die. Okay. So, it's not a program. There is no programmed cell death. But in apoptosis, there is a programmed cell death. This is how the cells have to die. Now, this is the time we have to die. So, that is apoptosis. Apoptosis, let's consider it something like suicide. So, let me write here itself. The cells are committing suicide. And necrosis is like a murder. So, see for example, how like murder will happen. For example, there is a bomb blast. Okay, there is a bomb blast in the region. Whenever there is a bomb blast, do you think only one cell will die? No. Do you think only one person will die? No. A group of persons, multiple people will die. The same way, necrosis also, multiple cells are going to die. Not one cell, many cells are going to die at once. But in apoptosis, not a group of cells, single cells will die. Okay, one cell will die. So, let me write here. Necrosis affects adjacent cells. Okay, even the surrounding cells will die. But apoptosis affects single cells. Okay, when you want to commit suicide, you will die. Okay, not some other persons, right? So, suicide is something personal thing, not a social thing, right? So, usually apoptosis also, a single cells will die. They will commit suicide. Okay, they will have this program and they will die. Next, during necrosis, the cell size is increased. So, the dying cell will increase in its size. But during apoptosis, cell size is shrunken. This is a very important word. Okay, the cells will decrease in their size. Cell size shrunken in apoptosis, cell size is increased in necrosis. Necrosis doesn't have any programmed, there is no proper sequence, simply the cells will die. How they will die, we will discuss. They will die. There is no such thing as program. There is no usage of energy, nothing like that. Cells are trashed and they are going to die. So, necrosis is a passive process. Okay. But apoptosis, it's a programmed cell death. So, it is active process. Okay, it's an active process. Means a sequence of events, sequence of reactions will happen that will kill the cell. Next, after the necrosis, see, imagine there is a bomb blast. I have explained you the necrosis in the form of a bomb blast where there is murder, okay, with the killing the people. Now, whenever there is a bomb blast, immediately to that area, the army will come, the local police will come, okay, and more response is going to be there. Okay, highly response is going to be seen because of this infiltration of the immune cells to that area, because something, this is always pathological. So, usually inflammation is seen in that area of necrosis. For example, in this area the cells are dying means because of the pathological reason. In that area inflammation, immediately inflammation will happen. All the immune cells will come into that area, produces the inflammatory mediators, okay, and inflammation will be there. But in suicide, not that much, okay, army is not going to be involved, just local police will come, just they will see and just simply settle the case. There is no much immune response, okay. So, inflammation is seen after necrosis. After necrosis, inflammation follows, but in apoptosis, no inflammation. Okay, no inflammation or no inflammatory response is seen. Next, in necrosis, what about the plasma membrane, the cell membrane? What happened to the cell membrane? The cell membrane is absolutely damaged, there is no doubt in that. Okay, cell membrane disrupted or cell membrane damaged, but in apoptosis, the plasma membrane or the cell membrane intact. Okay. So, after the irreversible cell injury, for example, after irreversible cell injury, the cell membrane is so much damaged, the mitochondria is so much damaged, the nucleus is so much damaged, automatically cell will undergo what? Necrosis. But in apoptosis, not like that. Cell is absolutely having its cell membrane, there is no damage to the cell membrane, everything is absolutely normal, but the cell is dying. So, cell size is going to get shrunken in apoptosis with the intact cell membrane. In necrosis, there is swelling of the cell membrane. Okay, because of the hypoxia, you know it, there is swelling of the cell membrane, swelling of the cells, the cell membrane is getting damaged, myelin figures, irreversible damage can occur. After irreversible damage, necrosis. Okay, so these are the important differences between necrosis and apoptosis. Again, I am telling you, this is very important slide. Necrosis is pathological, always pathological. Apoptosis is sometimes physiological or it can be pathological. Multiple cells are involved in necrosis. Single cells are usually going to die in apoptosis. See, necrosis is passive process, no need of any ATP. Apoptosis is active process. Inflammation is present in necrosis, inflammation is absent after apoptosis. Cell membrane is damaged or disrupted in necrosis, cell membrane is intact in apoptosis. Now, after this, let us discuss about the first necrosis. First, in this video, let us discuss about the necrosis. So, how many types of necrosis are there? There are different types. Number one is called as coagulative, which is most common type, coagulative type of necrosis. Okay, necrosis types. The second type is called as liquefactive. Liquefactive necrosis. Third type is fibrinoid necrosis. Next, fat necrosis, caseous necrosis, okay. So, these are different types of necrosis and you should understand, sir, how we have classified the necrosis into different types. Based on what, sir? Based on what the necrosis is classified into so many types. Fibrinoid, fat necrosis, like liquefactive necrosis, coagulative necrosis. Based on what? Based on histology, based on the appearance, based on the morphological appearance. okay, after the death, based on what? Based on, I should say, microscopic appearance. So, after the cell death, take that sample and put it into the microscope. So, based on the type of microscopic appearance under the microscope, the necrosis is divided into different types, mainly these 5 types. Now, let us discuss about the coagulative necrosis. Let us begin with the coagulative necrosis. Coagulative. Now, this coagulative necrosis, okay, it is the most common type, you already know it. Now, what you will see, sir, in coagulative necrosis, what you will see under the microscopy? See, if a tissue is undergoing coagulative type of necrosis, after the death of the tissue, you can appreciate the morphology, you can see the architecture better, okay, you can appreciate the morphology even after the death in a better way. So, architecture is going to be still appreciated. So, architecture is preserved. Okay, after the cell death, the architecture is still preserved, which means even after the death of the tissue, for example, there is myocardial infarction. Myocardial infarction is a type of coagulative necrosis. You take that myocardial infarction area, you put it under the microscope, still you can identify, sir, this is the heart tissue. You can see all the myocytes. Still the heart architecture, the cell architecture, the tissue architecture is preserved. Okay, so this is called as coagulative type of necrosis. What is happening? The name coagulative. What is getting coagulated? There is coagulation of the proteins after the cell death. There is coagulation of the proteins. Okay, coagulation of proteins. The cell. Most of our body tissues, coagulative necrosis occurs in most of the body tissues, which means most of the tissues after the death, still architecture is preserved. So, that is coagulative necrosis. See, seen in which organs? Most of the body tissues, mainly the solid organs. So, this is the question which they will ask you in your exam. So, in solid organs like heart, kidney, spleen. So, in the solid organs, okay, solid masses, you will see what kind of necrosis? Coagulative necrosis. What will be there? There is coagulation of proteins or denaturation of the proteins, which is still giving the architecture. So, the architecture is not completely damaged, architecture is preserved. After the death of the cells, if you put it under the microscope, the cells are going to look like the row of tombstones. What appearance? Row of tombstones. So, row of tombstone appearance. Okay, for example, this is the basement membrane. Now, on the basement membrane, the cells are looking like this. Now, they are just looking like a tombstone, right? This is the tombstone. Okay, for a tomb, there is going to be a stone on which the name is going to be engraved. So, it just looks like a row of tombstone appearance. Okay, where there is no central nucleus. The nucleus of the cell is not there. The cell nucleus is not there. So, it just looking like the cells are looking like a row of tombstone appearance. And these individual cells in which the nucleus is not there. Okay, in the individual cells which the nucleus is not there, the cells are called as ghost cells. The cells are called as what? Ghost cells. So, these are some important points which I want you to know in coagulative necrosis. In exam, they will ask you architecture is preserved, denaturation of proteins in heart, in kidney, in spleen. Okay, so most of the time, see for example, imagine this is a tissue. Okay, this is a tissue for example. Now, this tissue is getting the blood supply, proper blood supply. Imagine this is the blood vessel, okay, which is supplying all this area. This whole area, okay, is supplied by this one blood vessel. Now, if there is a block here, okay, if there is a block, there is thrombosis. So, this entire area, okay, this entire area which was supposed to get its blood supply, now it is not getting its blood supply. So there is first ischemia leading to hypoxia. If there is continuous hypoxia, there will be reversible cell injury followed by irreversible cell injury. As it's a solid organ like kidney or spleen or heart, it will undergo which type of necrosis? It will undergo coagulative necrosis. So all ischemias, okay. So ischemias will cause coagulative necrosis, mainly coagulative necrosis. And do you know how that area is going to look like? So the area is going to have a wedge-shaped infarct. That infarcted area, infarctions are actually, for example, let me write here, infarctions. If I am using the word infarction, myocardial infarction, infarctions are nothing but coagulative necrosis. How that infarcted area is going to be? The infarcted area will look like wedge shape. So, wedge shape area. So, whenever you see on the gross morphology, whenever the necrosis is happening in the form of a wedge shape, okay, so it's coagulative necrosis seen in solid organs. Now, after coagulative necrosis, the second type is called as liquefactive necrosis. Now, what is the difference between coagulative necrosis and liquefactive necrosis? See, in coagulative necrosis, the tissue architecture is preserved. But in coagulative necrosis, which is also called as colliquative necrosis, okay, in colliquative necrosis, the architecture is not preserved. Okay, architecture of tissue or the architecture of cells not preserved. In liquefactive necrosis, do you know what exactly is happening? After the death of the tissue, you just take that sample and put it under the microscope. You cannot identify the cell architecture. You cannot see anything over there. It's totally liquefied. Okay, totally like liquid. The architecture is not preserved. So, it is seen in which organs? In solid organs, coagulative necrosis is seen. So, in organs which are having high enzymes, okay, in tissues which are having high enzymatic activity, okay, high enzyme activity like pancreas, okay, pancreas and brain, spinal cord. See, in these areas, high amount of enzymes are going to be there. So, after the death of these areas, the tissue architecture is not going to be preserved. Okay. So, even abscess also, in some of the exam they have asked, in one of the exam they have asked abscess. So, abscess is an example of liquefactive necrosis. Okay. So, liquefactive necrosis, tissue architecture is not preserved, seen in organs which are having high amount of enzymatic activity. Abscess is an example, it's seen in, okay, liquefactive necrosis is going to be seen in pancreas and brain, because you know it, pancreas is enzymatically active, lots and lots of enzymes, pancreatic enzymes, sir, like trypsinogen, chemotrypsinogen, procarboxypeptidase, pancreatic lipase, colipase, okay, pancreatic amylase, multiple enzymes are there, so much enzymes are there. So, if the enzymes are leaking into the tissue because of the cell death, if the enzymes are leaking into the tissue, these enzymes will totally going to digest away the tissue. So, there is nothing left over, it is totally liquid like a liquid paste. So, that is liquefactive necrosis. What they will ask you in your exam is, they will show you the brain, okay, they will show you the brain and there will be an area, okay, which is dead. So, they will ask you which type of necrosis has happened here. Liquefactive necrosis, as simple as that. Now, after this, the third type of necrosis is caseous. Caseous necrosis. So, what exactly is this caseous necrosis? It is usually seen in the lungs in certain infections like TB, in TB infections, histoplasmosis. Okay. So, in histoplasmosis, TB, in all these infections, in the lungs, the necrosis will happen, the tissue is dying, the dying tissue just morphologically, okay, gross appearance, the dying tissue will look like cottage cheese, it look like cheesy, okay, fatty, cheese-like. So, such type of necrosis where at the end of the day, because of the tissue death, If the dead area, if it is looking like cheese-like, then it is called as caseous necrosis, usually seen with certain infections of the lung like TB, histoplasmosis. Okay. So, what exactly is happening in caseous necrosis? It is coagulative necrosis. Coagulative necrosis, which is most common. Along with the coagulative necrosis, there is also liquefactive necrosis. So, coagulative necrosis is happening as well as liquefactive necrosis is happening. Now, if you ask me why there is this cheese-like appearance, because in these infections, for example, TB, Mycobacterium tuberculosis, now this organism is growing, right? In the dead area, the microorganism is replicating. Now, this organism have high lipid content, okay? So, these organisms have high lipid content in the microorganism. Okay, in the cell walls of this microorganism, there is high lipid content. So that's why after the death of the tissue, it's going to look like cheese. Okay, cheese-like. That is caseous necrosis. So caseous necrosis is only one thing, cheese-like necrosis seen in histoplasmosis, TB in the lungs. The next type of necrosis is called as fat necrosis. So wherever there is fat in your body, so usually fat is present where? Fat is present in the breast tissue, in the females, in buttocks, in the abdomen, okay, in the omentum. Okay. So these areas, whenever they are getting traumatized, for example, now this female who is going in a car, okay, a female who is going in a car, now she had an accident, for example. Now what happens, that steering wheel, that's now she might have totally pressed against, they might have her breast have totally pressed against the steering wheel. So because of this trauma, there can be breast necrosis that is happening in the breast tissue, fat necrosis that is happening in the breast tissue, okay. And omentum also, for example, whenever there is a stab injury, the omentum, the larger omentum, the greater omentum will be affected. Omentum is full of fat, okay, and buttocks also full of fat. So whenever there is a trauma, hard hit onto these areas, the fat will die, okay, the fat will die. And that necrosis, whatever is happening in the fatty areas is called as a fat necrosis. What you will see here, okay, so fat necrosis is seen in fat rich areas after or due to trauma. Seen in which condition? For example, say, seen in acute pancreatitis. Acute pancreatitis. See, why in acute pancreatitis there is a fat necrosis? In acute pancreatitis patient, he is going to have the fat necrosis. Why? Now look here, imagine this is the pancreas, head of the pancreas and the tail of the pancreas. Now you know already the pancreas, whenever there is a damage, see, whenever there is a damage to the pancreas, it will undergo liquefactive necrosis. We have discussed the pancreatic parenchyma, this pancreatic parenchyma, it will undergo liquefactive necrosis, no doubt in that. But what you should know is pancreas is surrounded by fat, which is called as a peripancreatic fat. Okay, there is peripancreatic fat. Okay. Now, whenever there is acute pancreatitis, this area is undergoing fat necrosis, this area is undergoing liquefactive necrosis. Okay. Now, these enzymes will be leaked. The enzymes are going to leak out, the pancreatic enzymes, the lipases will leak out into the peripancreatic fat. Now, this peripancreatic fat will undergo fat necrosis. So, these areas are undergoing the fat necrosis. So, whenever there is a fat necrosis, right? So, whenever there is a fat necrosis, from this area, fatty area, who is going to be released? Fatty acids. So, fatty acids are going to be released. Now, wherever there is a fatty acid, the calcium will go and bind with the fatty acid. Okay, calcium will come and bind with these fatty acids in the area of fat necrosis. So, wherever there is fat necrosis, you can see white depositions. Okay, chalky white, these are called as the chalky white depositions. Chalky white depositions. So, these chalky white depositions are going to be seen in this process. So, fatty acids binding with the calcium, this process is called as saponification. Okay. So, saponification, because of the saponification, what you will see? Chalky white deposits. And these chalky white deposits, what exactly are they? This is nothing but the calcium. The calcium is coming and getting deposited in the area where there is damage. So, this chalky white deposits or this saponification process is an example of calcification. Which type of calcification? Dystrophic calcification. There is an example of dystrophic calcification. So, what exactly is dystrophic calcification? If the calcium is getting deposited in the area of damage, in the damaged tissue, okay, in the damaged tissue, if the calcium is getting deposited, that process is called as dystrophic calcification. Don't forget pancreatic parenchyma. Pancreatic parenchyma. Okay, that's the pancreatic tissue, the main pancreas. Pancreatic parenchyma will undergo liquefactive necrosis. Liquefactive necrosis. Peripancreatic fat. Peripancreatic fat will undergo fat necrosis. Okay, done. Now, the next type of necrosis is called as a fibrinoid necrosis. So, fibrinoid means fibrin like pink color deposition. In the area of necrosis, there is pink color, hyaline like material is going to be deposited. Usually, this fibrinoid necrosis is immune complexes. Okay, these are nothing but this pink color material is nothing but the immune complexes. So, where these immune complexes are getting deposited? Immune complex means antigen plus antibody complexes. Where this antigen antibody complex are getting deposited? Within the blood vessel wall. Within the wall of blood vessel. So, after getting deposited in the blood vessel wall, they are going to cause the damage to the blood vessel wall. So, necrosis is happening within the blood vessel wall. So, these blood vessel walls which is undergoing death is called as a fibrinoid necrosis because of the pink color deposition, which is nothing but the antigen antibody complexes. Okay. So, it is seen in which conditions? In which conditions these antigen antibodies are going to come and get deposited getting deposited within the blood vessel wall? Seen in conditions like PAN, polyarteritis nodosa. Okay, polyarteritis. Poly means multiple, arteritis means the blood vessels are getting involved. Arteritis. Okay, polyarteritis nodosa. And in rheumatic heart disease, okay, you will see ash of nodules, right? In rheumatic heart disease, you will see ash of nodules. So, this ash of nodules which are seen in the rheumatic heart disease are example of what? Fibrinoid necrosis, polyarteritis nodosa, fibrinoid necrosis. Okay. So, this ash of nodules, one important point I want you to know, these are pathognomic. Okay, they are pathognomic of rheumatic heart disease, and ash of nodules are examples of fibrinoid necrosis. Fibrinoid necrosis, where you will see fibrinoid necrosis usually seen within the blood vessel wall of the blood vessel. So, with this we have completed different types of necrosis. So, one word, fibrinoid necrosis, blood vessel wall, seen in vasculitic disorders like polyarteritis nodosa, and also seen in one infectious condition which is called as the rheumatic heart disease. Next, fat necrosis in the fat tissues, in the high fat rich areas like breast, omentum, buttocks, where there is saponification, deposition of the calcium over there, which is an example of dystrophic calcification. Okay, chalky white deposits are going to be seen. That is the fat necrosis seen in the peripancreatic area. True. And caseous necrosis. Caseous necrosis are seen in the lungs in the conditions like TB as well as histoplasmosis. The cheesy appearance, the cottage cheese like appearance is because of the high lipid content within the cell walls of microorganisms. Liquefactive necrosis occurs in high enzymatic activity areas. Okay, not lipid rich, high enzymatic activity areas like pancreas as well as the brain. Okay, and abscess is also an example of liquefactive necrosis. Liquefactive necrosis is also called as coagulative necrosis. And the most important type of necrosis is most common type of necrosis in the body. It's a coagulative necrosis, where you are going to have a wedge-shaped infarcts. All infarcts are the coagulative necrosis seen in the solid organs like heart, kidneys as well as the spleen. What you will see is rhomb of tombstone appearance. Architecture is highly appreciated. Architecture is maintained. Okay, row of tombstone appearance is seen, as well as the individual cells without the nucleus, they are called as the ghost cells. And the point which I want you to know is all these different types of necrosis, they are classified based on what? Based on the microscopic appearance. Okay, based on the appearance in which they are dying under the microscope, they are divided into different types. So, different tissues are there in the body, different tissues will undergo different types of necrosis. All these necrosis are always pathological. Necrosis is always pathological. Now, after this, in the next video, we will be discussing about the apoptosis. Okay, so what is the intrinsic pathway of apoptosis, extrinsic pathway of apoptosis, that will be discussed in the subsequent video. Hope the video is helpful. Thank you.